Mr. Chairman. I'm glad to be continuing our discussion on this really important issue. I know our witness today has been following the opioid crisis and its growth into the full-blown epidemic families and communities across the country are facing today. Mr. Quinones, thank you for joining us. I also want to welcome your wife and daughter, whom I assume are sitting right behind you there. I'm glad they were able to be here with you today. I look forward to hearing your perspective on how we can better help our communities fight this crisis and support all of those who've been impacted. And I really appreciate the investigative work that you've done to help shed light on this challenge. Of course, and I'm sure you'd agree, the rise of this epidemic is broader in scope than any one book can tell. There are people from every background and every corner of the country who have stories about the harm that this has done, and they are parents who've lost children to an overdose, children who've lost parents to an overdose, veterans in chronic pain who are struggling with addiction, doctors who are treating babies born addicted to opioids, and a lot more. I've heard these heartbreaking stories firsthand traveling around my home state of Washington and meeting with doctors and families and communities fighting this disease. I was visiting a local hospital in Longview, a rural community in my state, and the staff there told me that almost 1 out of every 2 babies born there have mothers who struggle with substance abuse. That was astonishing and heartbreaking, but it's unfortunately not the only evidence of this epidemic. Since 2000, nearly 10,000 people in Washington state alone have died of opioid overdose. And this isn't just happening in Longview, it's happening in local hospitals across the nation. We are losing 91 people every day to opioid overdose. And when I say this epidemic affects everyone, I don't just mean the individuals facing opioid addiction, there are other victims as well. This epidemic hurts families. It leaves children struggling to cope with the impact of their parents' addiction. It leaves many of them in foster homes. It leaves parents who are shattered with the heartbreak of their child's illness, and leaves many struggling with the financial cost of opioid misuse and treatment and recovery as well. And this epidemic hurts our communities as a whole. It takes up resources of public health hospitals and law enforcement. It takes workers out of our local economy. It takes a toll on the morale of small towns and big cities alike with each new tragedy. And we are behind the curve on fighting this epidemic. One of the stories that stood out to me in your book was about a state employee from Washington Department of Labor and Industries, a woman named Jamie May. Jamie was a pharmacist charged with overseeing the cases of workers who were receiving prescription drugs for injuries. After 6 months, she noticed that some of these workers were dying from the same painkillers that they'd been prescribed. The paper she published in 2005 about the uptick in high-strength opioid prescriptions and deaths was one of the first papers in the country to document the impact of the crisis that we're now facing today. But she published her paper over a decade ago, which just shows we have been fighting this battle far too long, and we have to do more. Now, I'm glad that we have taken some necessary steps. In 2016, Congress passed the 21st Century Cures Act, which included nearly $1 billion of funding for states to address the opioid crisis through prevention and treatment and recovery efforts. And the Comprehensive Addiction and Recovery Act, which supports specific outreach for veterans and pregnant and postpartum women. It expanded access to medicated assisted treatments and much more. But there is a lot more to do. Along with many of my colleagues, I hope we can move more funding in the upcoming budget or appropriations agreements. First responders, state and local officials, treatment professionals, and families have made it clear continued federal funding is key to addressing this crisis. And unfortunately, we have heard a lot of talk from the administration on this, but we've yet to see the president take the kind of serious action that this emergency demands and that he promised families on the campaign trail. The White House's own Council of Economic Advisors released a report estimating the economic cost of the opioid crisis to be over $500 billion just for 2015. Addressing a problem this big will take an enormous investment of time and energy and focus and robust funding. The president's third quarter paycheck is not going to cut it. Our communities are crying out for serious solutions, not stunts. So I'm eager to see this committee continuing its bipartisan approach and to take substantive action to address this epidemic over the next few months. Mr. Chairman, I look forward to working with you to have all of our members bring their ideas forward so we can work on moving policies that help our families and communities. We have to do a lot more to fund prevention efforts and treatment programs and build on the gains we've made. This means immediately providing supplementing funding states need to implement evidence-based tools that can help turn this epidemic around. And we need to ensure that local stakeholders and partners, the people on the ground who know what works best in their communities, have the resources and information they need to respond to this crisis. It also means going beyond prevention and treatment and recovery. We have to work to support not only the individuals facing addiction, but the families and communities who are suffering as well. I'm interested to hear your perspective on this today and how we do that, and I'm really grateful for you coming here today to testify before us, because if we're going to beat the scourge of this opioid addiction, we have to fund and enact solutions that are as comprehensive as this challenge. So thank you again very much for having this hearing. I look forward to working with you and all our members.